Transforming your look at Refined Skin and Body Clinic is our topic today. We are here with Dr. Chirag Kotecha, the specialist, the oracle, the brain behind all the cosmetic and other procedures that are performed at Refined Skin and Body Clinic. We are going to explore how you can transform your look through cosmetic enhancements at Refined Skin and Body Clinic. That includes dermal fillers, skin tightening, Botox. What is that? Are they going to, give you a bigger butt, bigger breasts, smaller, The doctor is going to demystify all these, questions that we've had about it. We've watched, other cosmetic procedures performed in other countries. Do they exist in Uganda? Is it legal? Is it safe? Is it advised? All these questions are going to be answered today with the doctor. Doctor, good morning.
Good morning. How are you?
I'm fine, thank you. How are you today?
Good, very good.
Have you had anything cosmetic done on yourself before?
A lot. I
Really?
practice everything, get everything done on myself before. Actually, not everything. Certain things like breast enhancement I don't do.
Yeah.
But a lot of things I've had done, experienced them, whether it's when I go for training in America or Dubai or the UK, or have people practicing on me here.
Exactly. That is more reassurance to give you more confidence that Refined Skin and Body procedures are all perfectly safe because he has tested them, he has done them on his body, and he's perfectly fine. So the first area or topic under transforming, enhancing your look through cosmetic enhancements or procedures is the dermal fillers. What is that?
Okay, so before we go into that, I just want to explain why people may opt to have these enhancements done.
Exactly.
If you look back historically and even around us, people who feel good in themselves or look good in themselves are more confident. They are more outgoing, possibly. We have a bias between all of us that somebody looks better, is more employable, especially at a front customer service level kind of thing.
Exactly.
So they secure more jobs. This is a statistic proven time and time again. So this is where people come in to look for these enhancements. Now, our life expectancy in Uganda, from being about 40, 45 years old when people used to die, now people live to the 70s, 80-year-olds. So hence the requirement or desire to look younger.
Exactly.
Also, we are constantly bombarded by TV shows, magazines, and the celebrities where good looks, high cheekbones for the ladies, nice lips, etc. is a sign of beauty.
Exactly. And a sales point for them. Their
correct.
Music sells more.
So that is where people come looking for it. Now, when you go back to dermal fillers, dermal fillers are a type of, it's collagen really, hyaluronic acid. There's different type of fillers, but dermal fillers are hyaluronic acid fillers that are used to reduce what are called static lines. Now, if you look at somebody's face, for example, for wrinkles, there are two types of lines that are formed. There are the dynamic lines, which happen due to movement. When you smile, people get some smile lines, lines on the side of the eyes, lines on the forehead. Those are called dynamic lines from movement. Static lines are the ones that form due to repeated movement over time, where you lose the collagen and you develop this maybe deep laughter lines around the face, other kind of indentations in the face. That is where dermal fillers are used. It's a type of injectable that is injected very safe. Again, US FDA approved, USE approved in Europe. It's injected into particular parts of the face or the body for body enhancements to volumize, to increase the volume. Because again, if you look at the aging process, you lose quality of the skin, so structure in the skin, your bones become softer, you get bone resorption, which is where the bone gets sucked in. So with that comes these lines. So we start injecting dermal fillers to volumize and lift particular parts of the face, whether it's the temple, the cheeks, the jawline, reduction of the laughter lines. Now, if you go back to my training, I've been in this practice for over 20 years.
Exactly.
Initially, we used to just focus on particular areas. So if somebody came and said, I want to reduce my laughter lines, we just inject fillers there. But over time, people don't want to be seen as though they've had injections done. They want a more natural appearance. So now we go for a 360 approach, where we know that the laughter lines you develop are due to, like I said, loss of volume on the temples, on the cheeks. Then you get that drooping that causes these lines. So now we inject the dermal fillers all across in different areas, not particularly focusing on this area. So through my courses, I'm US board certified in the American Academy of Aesthetic Medicine. I'm a master injector, so I've repeatedly trained, practiced different modalities, and developed it. Again, good question you asked earlier was its transformation. So I know we'll delve into this, but dermal fillers alone would not be the solution. It's a combination of things we like using, because aging is multifactorial. You age because of your genetics,
what you're eating,
smoking habits, sun exposure. So don't expect to come in and tell the doctor that I want dermal fillers to reduce this. And then inexperienced doctor will say, okay, fine, let's inject that. But somebody with experience, which also comes with me with time, is that we start using combination of treatments to now enhance that appearance of yours in a natural setting, where you can step out of here most of the time, not all treatments, but most of the treatments, you can step out of here and go continue with your day. You'll go to your office, look refreshed.
Yeah, you mentioned that apart from using them on the on the face to either reduce the lines that could appear here when someone's making happy gestures, or here, or the wrinkles up here.
Oh. We'll talk about that.
Okay, we're going to talk about that. You also mentioned that it can be used on other parts of the body to increase.
Yes.
So now, whoever is listening might start thinking, okay, so if they put the dermal filler in my butt, would it, enhance the shape? If they put it maybe on my chest, would it increase that? So explain that. What do you mean by?
So there's different densities of dermal fillers. So there's the lighter ones, which you can use, for example, the lips, maybe finer lines on the forehead. Then there are the slightly thicker ones that you can use on the cheeks or the jawline. For the breasts and the body, we use something with what is called a higher G prime, higher concentration of hyaluronic acid in the filler to enhance that area. Now, the longevity or the lifespan of the filler really depends.
On what?
For areas of big movement, for example, lips, it would last less. For nasal enhancement, for the nose bridge, where in Africa we've got a lot of flat noses, we can use it to enhance the nasal bridge, and that lasts longer. For the breasts, we really don't do much of it because of the incidences of side effects possibly. But like for the hips, well, they say that it sort of masks signs of breast cancer. So we do use them, very, very carefully used. However, the gold standard for breast enhancement is really silicone implants or breast implants, but that's a surgical procedure. If you don't want surgical procedures, there are other options. Yes, we can use fillers in select cases after we've ensured that they don't have any history of breast cancer or in the family, we've done a mammogram, etc. But for the hips and buttocks, it's very nice treatment, although it doesn't last long.
How long does it last?
For maximum 6 months, really. Fillers in the hips and buttocks don't last long. So people have a lot of hip dips or injection holes. We do something called subcision to remove the scar and then fill in the dermal filler. It doesn't last long. There are better options such as collagen stimulators, something called Sculptra or Ganafil, which stimulates your body to make its own collagen, and that lasts for up to 3 years. Or you do liposuction and fat transfer for the hips and breasts also. Fat transfer, which would last longer. That is safer.
So I have 2 questions around that. What are the risks of having a dermal filler in the hips and butt area? And then secondly, is it, with Africans, we have this mindset of anything that is not natural, and something that's just artificial. I would say artificial because it's something external getting into your body in the hip and the butt area. How healthy is it? Yeah. And if it's lasting for a period of 6 months, can't I just renew if I'm okay with just coming back for another Botox and another
filler? Yes.
Yeah, another filler, and to take me for another 6 months.
So firstly, the most common risk factors are mitigated or reduced by going through an experienced hand. Somebody who knows the anatomy. Don't go to any just clinic or beautician and say, I want fillers put in, which is I see a lot in social media happening. People just injecting stuff without any experience. You need to know the anatomy. You inject that filler into a big blood vessel, you can get a clot in your heart or your lungs. You can die. That's the most severe side effect. Somebody comes and stabs it in and doesn't know what they're doing, where the anatomy is a problem. So ask to see the qualification, the training certificates of the doctor before we do that. Because we've talked about it before. Knowing how to do it is part of it, but handling the complications is the major part. So make sure you're a trained person. Number 2, if it's not a clean environment, if they've not cleansed the area properly, sanitized it, disinfected it with betadine, for example, high chance of infection, granuloma formation, which the body recognizes a foreign object and then closes it in a certain capsule.
So you
That would
swell
need to
in
break
that
it.
area.
Correct. That would need to be surgically removed or dissolved. So
And
those
that's
are
another
those are the
expense.
common. And infection. Those are the common ones. It's a very safe medication. Again, has got approvals, been tried and tested. There's numerous studies on it in the dermal fillers for body enhancement. More naturally for there, you've got the PRP treatments for the face, not for the body really.
Yeah.
For breasts, we can do it, but not for the hips. You can use some of it to stimulate your own body's collagen. Again, the Sculptra, or the ingredient called PLLA, polyallactic acid, is a substance that your body sort of uses to make its own collagen. So more natural appearance. Takes a bit longer, is a bit more expensive, but again, it's safer than just using dermal fillers straight, whether it's on the face or the body, and lasts longer.
Yeah.
Collagen stimulators. But the safest alternative using your own body products is your fat. Taking out your own fat and transferring it. However,
the liposuction.
Correct. Liposuction and fat transfer. But again, the depending on the procedure used, the equipment used to remove the fat, depends on how long the fat will survive, whether it will survive at all. So you need, again, an experienced person who's using correct equipment to do that procedure. Again, that still has its risks, so make sure you go to somebody who's experienced,
Yeah,
trained.
I mean, everything really has risks.
And it has surgical risks, obviously, the liposuction and fat transfer.
Okay. Moving on to the next, let us talk about the Botox or Botox. What is that? What does that mean? What procedure is involved in that? How many Botox am I supposed to come for?
So Botox is a trade name for botulinum toxin. Botulinum toxin is actually the scientific name. This is a purified toxin that is injected for various reasons, which I'll explain. So Botox, which is commonly known as a produce of a company called Allergan from the US, which manufactures Botox. But there's numerous types of botulinum toxin available. All of them, most of them have been approved, whether it's in the US, FDA or CE approved. Again, safe products. The mechanism of action is that when you inject it, let's talk about those dynamic lines we're talking about, when you raise up your eyebrows. I've had it done, so you can see my movement is not as much, but you have it. So I've had it done. So it's an injection that small injections across the face that help reduce the what is called acetylcholine, which is the neurotransmitter acting on the muscle. So when you try and make that movement, your body's releasing a chemical that goes to the muscle and makes that muscle move. By injecting Botox, that mechanism is not able to happen. So the muscle is not able to contract. It's firm. So we can use it for wrinkles on the forehead. At lower doses, we can use it to help close up pores, tighten up the skin. We can use it for patients with cerebral palsy who've got contractures or tightening of muscles. We can inject it into the muscles. I use it for migraine patients who suffer from severe migraines. It helps reduce the muscle activity in migraines. And we can also use it for hyperhidrosis or excessive sweating, whether it's on the forehead, underarms. So it's injected. Now, it takes anywhere between 4 days to 2 weeks to really appreciate the results after Botox treatments. And how long it lasts is dose dependent. So the higher the dose you put in, the more frozen you'll be, for example, your movement will be reduced, but the longer it will last. So if you're looking for a balance between natural and some movement, we put in a lower concentration or lower number of units of Botox. It's measured in the number of units, and the less it will last. But average anywhere between 3 to 5 months.
3 to 5 months.
You should repeat it 3 to 4 times a year for the facial aesthetics. For migraines, maybe every 4 to 6 months. For sweating, the mechanism would last about 6 to 9 months. So different indications, different areas, and it's all dependent on the number of units you put in.
Yeah, oh, that's pretty interesting. I mean, I'm imagining someone who doesn't want to laugh all the time, and I'm just imagining if you put a Botox maybe here, and then I want to laugh, but I can't.
It depends on the level. So again, knowing an experienced doctor to do it, there's different layers of the muscles. Some muscles are superficial, some are deep. If you're looking at it for skin indications, you go very, very superficial. So we really need to know what you want to achieve. Again, one thing, Botox is probably the longest or most widely used cosmetic in the world. Has been in use since 1978.
Wow.
So millions of cases done in the world. The most highly used cosmetic procedure in the US and probably the world is botulinum toxin or Botox.
Wow, impressive. Up next, we're going to look at hair, sorry, I forgot, it's hair what?
Restoration.
Moving on, we are going to talk about hair restoration. Take us into that.
So hair loss. I mean, there's many reasons for hair loss. One, which I experience from, is androgenetic alopecia, or hormonal male pattern hair loss, where you lose hair from the sides of the head and it thins out. In women, it usually starts up in the middle of the head and then spreads out this way to the sides. So those are hormonal pattern hair losses. Then we have the traction alopecia, which is very common in the African continent, especially in our region. Because of constant plating, braiding, using of chemicals, they lose hair on the sides. Then you've got other medical reasons for hair loss, such as alopecia areata, which is an autoimmune, and from cancer, yes, from chemotherapy, which is a different subset of hair treatment. There, you need to really overcome the chemo, move past that, and then maybe grow your hair. But hair restoration, really, what we do at Refine, it's a combination of treatments within the clinic and also at-home use of medicated products such as minoxidil. If you have an infection, we treat the infection first, most common being a fungal infection of the scalp. So we treat it with ketoconazole shampoos and creams to reduce the fungus in the hair, which again kills the hair itself. So it's important to see the doctor. Everybody has different reasons or cases of hair loss. And then management is based on home use of products, minoxidil, for example, biotin-based products, whether it's tablets or shampoos and conditioners. Then we come to the treatment part. What we do commonly here at Refine is PRP, or the vampire hair restoration, where we take your blood, we process it through the centrifuge, get your plasma and inject it into the hair with exosomes. At Refine, we also do exosomes, which is an advanced, something that is coming up very commonly in the world, exosome treatment to help stimulate hair growth. So it's a treatment that is done once a month. You do it for about 3 months. Then after that, depending on the indication, maybe every 6 months. So for me, for example, if I look at myself, I've been using minoxidil since I was like 22 years old. Had I not been using it by now, I'd be bald. I know my hair is thinning because I've not done my PRP treatment in a long time. In the beginning, I used to do it every month. I did it for about 3 or 4 months, then every 6 months. I've not had a treatment done in over 1 year right now because I've not got anybody to really do it for me. So that's why it's thinning again. But once I do it, my hair is visibly stronger, thicker, and there is stimulation of hair growth. Again, it's not permanent because this is hormonal. I can't stop my testosterone levels, my hormones in my body. So as the hair grows again, the body kills it. Unless I go for other medication, which has its own side effects. There's a medication called finasteride, which can be used for hair restoration in men, but it leads to, or a common side effect of it is impotence, which is something I don't want right now. So it's trying to weigh up what the patient wants. Is the hair the big issue? So we manage it. Again, using combination of treatments. We've got LED hair growth treatments here at Refine, where you come in 2-3 times a week, sit under an LED mask. LED are the lights that you commonly have that stimulates your hair growth. So we combine the different things. It's bespoke treatments on somebody's lifestyle, what they want to achieve. Going back to the women who lose hair from traction alopecia, when we are treating it, we ask you to keep your hair as natural as possible. Don't plait and braid it, because by doing that, as the soft or the new hair is coming, you're breaking it and killing it. And regrowing hair is not magic. It won't happen in one session. It takes a few sessions. Then if you've got total hair loss, if you've got scarring alopecia, for example, where the hair follicles are fused, you may need to consider things such as hair transplant, which now at Refine, we've just partnered up with a team from India, from Aster Clinic in India, who'll be coming here monthly to offer hair restoration or hair transplant treatment. So it's something we'll start talking about in the coming weeks.
Wow, that's pretty amazing. And if someone doesn't have a history of maybe hair loss in their family, or doesn't have, you have perfect hair, but you just want maybe more volume, is it advised for them to come for these treatments, or they rather not?
Well, you might not need the treatments. PRP, again, is safe. We're using your own body's regenerating factors. So by using PRP, again, you will increase the volume, thicken the hair. So even if you don't have any issues and you want to grow that hair, we can do it. There's one important condition that I forgot to mention, something called telogen effluvium. Now, telogen effluvium is one of those conditions where if you go into the hair growth cycle, there's active hair growth, there is a resting stage for hair, and a shedding stage.
Yeah.
So you shed less than 5% of hair at any one time. Only 5% of hair is in that cycle. So when you wash your hair, you brush hair, you will notice some hair coming off.
Exactly.
But suddenly, if you notice a lot of it coming out, especially post-pregnancy, post a big family stress, such as a death in the family, cancer, depression, these can shift a lot of your hair from that active growth stage into this shedding stage, something called telogen.
Yeah.
That is telogen effluvium, which then your body overcomes in time as the stress reduces. So people get alarmed, they say, I'm suddenly losing hair. Come in, we test, we do a variety of blood tests to check your iron levels, vitamin B12, to make sure the thyroid levels, thyroid function, to make sure there is no underlying condition that is treatable, first of all. We treat that, then we start using these hair growth techniques.
Exactly. Thank you so much, doctor, for your time and for explaining the different options that you can explore when you want to enhance your look. We've talked about the Botox, we have talked about the dermal fillers, where they apply facial, body, the risks. But the main takeaway from here, ladies and gentlemen, always make sure that whoever you go to, they are a trained physician.
So we've got something, just going back, if you're not somebody who doesn't want the injectables, we've introduced, first in Uganda, I would say, something called the M-Face or the Rena-Face machine. It's a muscle stimulation machine of the face. You come in for a treatment 2-3 times a week. It's a lot more cost effective or cheaper than having the injections done.
And less painful.
Less painful. It takes longer, but for people who want to tighten the face without having to undergo those injection techniques, it's a machine that we put the sort of stimulating pads. It's like exercise for your face. It stimulates the muscle to contract and then helps tighten and lift the face. So that's something new. We'll see a video on it coming soon.
Exactly.
To show our viewers how that works and what it does for you.
Exactly. And like doctor mentioned, please make sure that whoever is working on you is a trained physician. The environment you're in is clean. All the needles that they're using to
Sterilized,
inject,
disposable.
Yeah, they're sterilized, they're clean, and make sure that you know the goal. You know what you want to achieve out of maybe having a dermal filler done. You want to know what you want to achieve having a Botox done or having your skin tightened, because it's really important. If you don't know what you're going to achieve, someone will just you'll be shocked with the results.
One piece of advice somebody told me, which I think should be for definitely our listeners and our patients. If you're in doubt about the doctor's capability, qualification, ask to see their training certificates. A doctor should not shy away from that, should not run away from it, should provide you with physical evidence of their training, their qualifications, to show that they're licensed to these products, procedures.
Yeah, exactly, that they're capable of doing that. Some people might feel a bit shy, or I think it's rude maybe to ask that, but I feel like to be safe, you rather be safe than sorry.
We spend a lot of money on our training and education, so you get, this is not unique to Uganda. I see it in England, I see it in a lot of other countries where beauticians are coming up and say doing PRP treatments, they're doing the Botox, whatever. Now, have they gone to the same level of training as a physician or a doctor who's spent years studying it? And that's why they're possibly more expensive than the competitor who might do all this by taking shortcuts. They're not. So if you're the person who has that challenge or the complication, are you sure you want to be in that person's hands?
Exactly. And remember, if you get undesired results, it might be even more expensive to reverse the effects. And if you get a swelling, if you get an infection.
We had a patient yesterday, it's digressing on the topic. He came in after, he has a tattoo on his chest, and we did a video that you'll see with our new picosecond laser machine. He had tried to get it treated in town by somebody who scrubs it off. I don't understand how that concept works, but he has scarred his chest now. So if you look at it, there's scarring there. And I asked him, what did they do? He said they put some rough, like I would say the pumice stone that you used to clean your feet, for example. They said they tried to scrub off the tattoo, the skin layers with that. Now he's damaged his skin.
Oh, my goodness.
Whereas that tattoo treatment removal would have cost, that refined would have cost, say, 150,000 shillings per session. I had to charge him 300,000 purely because, the risks were higher, there was scarring there. I had to do it myself rather than have my therapist do it. So these are things that when you try take those shortcuts and you've not understood the process, you've
Yeah.
got Google with you nowadays. Do a Google search.
Exactly. Do your due diligence.
Yes.
Search before you go for any procedure. Thank you so much, doctor.
Thank you.
And you will catch us next time for another exciting topic from Refined Skin and Body Clinic. Be flawless.
Thank you.
Thank you.